Your horse suddenly goes quiet, he's not finishing his feed, and the whites of his eyes are looking a little yellow. Most owners jump straight to liver disease, but here's the twist. Jaundice isn't the most reliable indicator for liver disease in horses. Let's talk about what really matters. Before we talk disease, we need to talk jobs. Essentially, the liver is a horse's biomechanical Swiss Army knife. It detoxifies, it produces proteins and clotting factors, makes bile, stores vitamins, and manages energy metabolism. If the liver isn't happy, nothing else is happy. Horses don't get liver disease for just one reason. They get it for 5 big ones. The big one, which everyone knows, is toxins. Ragwort, for example. That common yellow garden weed that we see on grass verges, roundabouts, that sort of thing. Horses try not to eat ragwort because it generally tastes quite bitter, but if there's no other forage available, then that's when they're going to start grazing on the weed. Another common cause of ingestion is when it's chopped in hay and desiccated, and horses might ingest it this way. Other toxins are things like blue-green algae and mycotoxins, which you might find in mold or fungi. Next, we have the infectious causes, such as Tyler's disease and leptospirosis. And common in older horses, you might get cholangiohepatitis, which is a severe bacterial disease which affects the bile ducts, causing inflammation and also affects the surrounding tissues as well. Metabolic causes may include hyperlipemia and right dorsal colitis. We have obstructive causes, inflammation of the bile ducts, for example, or blockages. And then, of course, we have neoplasia as well, so cancerous tumours. This is quite rare but more common in older horses. Owners usually only know about ragwort. Vet students know about Tyler's disease. Vets know that it can be a combination of everything. But here's the tricky part. Liver disease can be sneaky. And most early signs look like, well, everything else. Lethargy, reduced appetite, photosensitivity, weight loss, behaviour changes, mild colic signs, and of course jaundice. But it's important to realise that jaundice isn't liver specific. It can be caused by a number of other issues. Jaundice in horses is more commonly caused by not eating, anorexia, not just from liver failure. So if you're waiting for yellow eyes to take liver disease seriously, chances are you're probably going to miss it. This is where the vet brain kicks in. Diagnostics are going to include blood tests, ultrasound, and sometimes even liver biopsy. On biochemistry, we're going to be looking at liver inflammation markers. The first one is GGT. This is an indicator of biliary tree inflammation. We can look at AST, but it's worth noting that AST doesn't only rise in liver disease, but also in muscle disease as well. So we need to compare our readings to exactly what patient we're working with and really compare those notes to the clinical picture. We'll also look at SDH, which is the most liver-specific biomarker we have. And then finally, we're going to be looking at bile acids, which is going to tell us how well the liver is functioning. Where GGT, AST, and SDH are going to tell us if there's been an insult on the liver causing inflammation, bile acids is going to tell us how well the liver is still functioning. Normally, once we start seeing an increase in bile acids, prognosis becomes less good. If bile acid levels are still within normal limits, it means that the chance of regeneration of the liver is good. We may also look at a coagulation profile. We know that the liver creates clotting factors. And of course, we're going to look at ultrasound. Specifically, we're looking for heterogeneous texture, hyperechoic areas, and duct dilation, all caused by inflammation and potential fibrosis. And yes, sometimes we need a liver biopsy. Luckily, this can be done by first opinion vets and can be done under standing sedation. But looking at the liver at a cellular level is often the only way to get to the bottom of what's actually going on. Treatment depends entirely on the cause, but the principles all stay the same. Firstly, we need to remove the toxins. We need to support the liver whilst it heals. This might be done with fluids, antioxidants, vitamin B complexes. Anti-inflammatories may be prescribed to get on top of that inflammation process. lactulose for hepatic encephalopathy, antibiotics if the cause is cholangiohepatitis, and a change in feeding strategy, often with low protein and high quality forage, and we're going to feed small frequent meals. If we give it a chance, the liver is really good at regenerating. Here's a part that owners really need to hear. Early detection gives us the best outcomes. It allows us to intervene sooner and allow that liver to regenerate before we get that raise in bile acids because the liver isn't functioning as well as it used to. We need to control ragwort in field, usually by digging them up so the horses can't ingest them. Avoid sudden diet changes. Monitor weight and behaviour so that you pick up signs sooner rather than later. Recheck blood so we can see early on if there's any insult to the liver. And call your vet early if appetite suddenly drops. Liver disease isn't always a crisis, but ignoring it definitely can be. If you want clear, calmer explanations of horse health without the drama, then hit subscribe. The Fresh Vet is here to make you the most informed person on your yard.